Good morning everyone, I am Aaleha Izza Baliwan from BSN2A and now I am going to do a return demonstration for female and male catheterization. So for the female catheterization, so the first thing that I will do is to check the doctor's order or the patient's chart. So I have here my patient, which is Mrs. Layla. Mrs. Layla Gray, 46 years old, with a medical number 143. So I see here that the patient or my patient um, was unable to void for 6 hours post-op. So um, I will assess. I will also assess if the patient is um, allergic to iodine or plaster for the patient's safety in using the equipment that I have for the procedure. And then now I am going to wash or sanitize my hands to prevent the spread of microorganisms. So then I will prepare or assess or assemble my equipment. So I have all the equipments here that I'm going to use for the procedure. Then I have here the external douche tray. I have here the gloves, and I have the plaster, the betadine, and the cotton balls. And inside, I have the uh, sterile gloves of my size, the 5cc syringe with a vial of distilled water, and with the urine bag. Um, I also have the Foley catheter with a size of 14, which is for women. And I also have the kidney basin, um, a forceps with a sterile solution. And I also have the lubricant inside, and then the OS, and then I have the uh, I already put the waterproof underpad in the bed of the patient with the um, bath blanket. And then now I am going to make sure that you check the expiration date of the equipment for the safety of the patients. So now I am going to identify the patient and explain to her the procedure that I'm going to do. So, good morning, ma'am. I am Aaleha Izza Baliwan, and I will be your student nurse for today. So, ma'am, I have some questions for you. So, can I ask what's your name, ma'am?
Layla Gray,
Okay, so how old are you, ma'am?
46.
Okay, so your medical record is 143. So, I um are you allergic to any iodine uh, or any allergies, ma'am? Do you have any allergies?
No,
Okay, so when was the last time that you urinated, ma'am?
I think last night.
Okay, so last night. So I think so last night. So that was a quite um quite long. So now I have an order here to do a urinary catheterization for you. Um, uh, Urinary catheterization. Um, uh, and that means that I'm gonna be that I am going to be, or I will insert a tube inside your urethra, and it's gonna be sitting in your bladder, and and will help drain any urine that's inside you. So the procedure will just take a few minutes, and you may feel a little bit of, or you'll feel uncomfortable or feel any pressure, but I will make sure that, or um, I will walk through with it with you, ma'am. So I am going to give you some, or I am going to ask you to do some deep breath, so which will help you lessen the pressure that you're going to feel. So, do you have any questions for me, ma'am?
None.
Okay, um, so now, um, um, I already provide a good lighting for better access, and then I already close the windows and the doors for the patient's privacy and to minimize the embarrassment of the patient. So again, I already put the waterproof underpad and the bath blanket into the patient. So now I am going to place the patient in a dorsal recumbent position, and then oh, I forgot that I already um I already have the drapes inside the sterile pad, and then um now I am going to make sure not to touch the sterile area with an unsterile, so it will. So now I am going to put the drape on the patient, and so I have here the drape. So I already put the drape, and now I am going to do a cleaning. Perineal cleaning. So I am going to get some gloves. So as I cleansing the area will help to minimize the spread of infection. So I will get some cotton balls, and then clean the area upward to downward. Then now I am going to prepare the Foley. Now I am going to prepare the Foley catheter in the area and with a lubricant near the perineal area or the area. So now I'm going to take off these gloves. I am going to squeeze a small amount of the lubricant over the area or the sterile OS. And then I will get 2 cotton balls with betadine from the jar and place it into the sterile two cotton balls. So now next is I am going to put the sterile gloves. So this is the sterile gloves with my size. In putting the sterile gloves, make sure that you only do it or touch it with a sterile, or make sure not to touch the sterile area of the gloves. So now I am going to place the fenestrated drape over the vulvar area, exposing the labia to provide the sterile field. So now I am going to lubricate the catheter or the Foley catheter I am going to lubricate the catheter from 1 to 2 inches. I am going to lubricate the tip of the catheter from 1 to 2 inches, and lubrication will help facilitate the insertion of the catheter, and it will reduce the tensions or the tension into the tissues. So then with the thumb and forefinger of my non-dominant hand, I am going to spread the labia. I'm going to spread the labia with the dominant hand and disinfect the meatus with meatus twice with cotton balls with betadine. So I am going to use the forceps in cleaning. And then after that, I will slowly insert the catheter. I will slowly insert the tip of the catheter in the meatus about 2 to 3 inches. 2 to 3 inches, or until a urine is seen. So I am going to insert it now. I am going to ask the patient to take a deep breath. So now, can you take a deep breath? And then I am going to rotate it. Now I am going to insert the water. So this is the 5cc syringe, and this is the sterile water. So I am going to withdraw up to 5. So now I am going to insert the water into the So now, after that, I am going to place the urinary bag under the bed of the patient where I can clearly check it or see it. So here, I put the urine bag under the bed of the patient. So now I'm going to clean the area. I am going to clean the area. I'm going to take all the grapes away from the patient, and then I am going to remove my gloves. And then I am so now the procedure is done, and then I will sanitize my hands, and then I'm going to thank my patient. So, ma'am, thank you for your cooperation, and as for the procedure, as for the result of the procedure, I will be back and I will check you. And again, thank you, ma'am, and
Okay.
that would be all for my written demonstration for female catheterization. Thank you.